Crystal, it's very, very nice to meet you. I'm looking forward to hearing more about you and your skin condition.
I'm 27 years old. I live in Blouberg. I work in my family's business, CNC Blonde Specialist. We have a branch in Table Bay Mall and in Durbanville. And in Durbanville, we do our Lamelle facials there, which is also very nice. If you guys want to go take a look, absolutely love it. So basically, my whole issue came with my skin was during COVID, with the mask and everything. My skin got very irritated, had a lot of breakouts, and I just felt so shy. I couldn't walk without a mask at all. And I'm tired of it. I'm tired of wearing so much makeup, and I just want a more natural feel without being embarrassed about my skin.
Got you. So your primary skin concern then, is it acne, or is it scarring, is it marks? What would you say it is?
Acne and scarring. So I would say the scarring is more there than what I would like it to be. And I'm just tired of wearing so much makeup just to cover it the whole time.
Do you still have active acne?
Currently, yes. Even though I was on the medication, it still comes up now and again.
Type of medication that you're on?
I was on Accutane.
Ah, right.
Yes, yeah, for 6 months with the face wash and the cream.
The actual acne issue is something that one is very, very common. Post-adolescence, we call this adult onset acne, is very common. And people who are wearing masks, working in hot, humid environments, can have an exacerbation, a worsening of this acne over a period of time. Now, that in itself is not something new. In terms of how we manage this, we've got to break this down into different elements. We have to focus on the scarring as a separate entity to the active acne. They sit in different parts of your skin. So the active acne, which can either be a blackhead or a whitehead or a comedone, they have different names, that sits inside the actual follicle, in the pores, right? Now, your scarring doesn't occur in the follicle or the pore, it sits in the deeper layers of your skin. So what we're needing to do is we need to focus on the follicle for the acne and deeper skin component for the scar tissue. And so there is not a one-size-fits-all for this. We have to choose our interventions quite carefully to try and improve that. You've mentioned that you're taking this oral medication for 6 months. It's a very, very well-known prescription drug for acne. It does also dry your skin out, dry your eyes out, etc., which means we also need to be mindful of your skin barrier. So our treatment approach is multifaceted. So we can't rely on home care entirely. Scars sit deep, as I mentioned, and as a result, to bring about an improvement in those scars, we have to do treatments that can reach that scar tissue area. So there's in-office treatments which are very, very effective for that. So that's something you must bear in mind. Home care, the different types of ingredients that can build collagen, remove scar tissue, they do work well on fresher, newer scars. An existing older scar needs the in-office treatment. So in terms of your active acne, we need to ask whether your skin is oily, dry, sensitive. How would you describe that?
So I'm currently experiencing a lot of dryness at the moment.
Well, you see, this is another very important point that I think patients who suffer from acne need to realize, is that not everyone with acne has very oily, greasy skin. Because I've potentially oilier spots on my face, because I have the red breakouts, I can't use any oils on my skin. That's entirely not true. If you have a broken or a disrupted barrier to your skin and you have acne, you're going to need to have some form of barrier protection, which is usually an oil base, not lots of oil, but a lipid base to help maintain that barrier. If you don't and you allow your skin to totally dry out, it will actually make your acne worse. And the reason for that is dryness doesn't cause acne, but dryness leads to inflammation, and inflammation worsens acne. We're going to target those areas with excess oil. We're going to help a little bit suppress the oil production. Mostly with the active areas, we're going to use ingredients, well, a range of ingredients that will reduce inflammation and get rid of some of the bacteria in the skin. But for the acne scars, that is where we're going to need a combination. And to take that old broken tissue, we can't just take the old tissue as it stands and just refix it back straight again. We can't panel beat the scar tissue. We literally need to remove it. Well, we don't remove it. Your own immune system removes it. So the professional treatments are aimed at signaling to your skin where it needs to go to remove that altered, broken tissue and lay down brand new structures. And with acne, it is not a short-term condition. It's something that stays in your skin for longer periods of time. So treatment for acne is usually ongoing. And you might have flares even with active treatment, but in time, it will slowly subside and get less and less. Crystal, thank you very much for sharing your story. I'm very excited for the changes we're going to bring for you in a very short space of time.
I'm also very excited to go on this journey with you. Like you said, Rome is not built in a day, so this is not going to happen in a day. So I'm very excited. Thank you.